I guess it's cheaper for them to give someone overtime than to hire another person. Gross salary 106. Hi guys, welcome to the village. My name is Boni. I create content around careers, education with a dose of reality check. Today we are looking at health sciences, and this is what you can expect from this video. It's a ComServe, a pharmacist, a medical technologist, a pharmacy assistant, a radiographer, enrolled nurse, and a doctor. Okay, so let's start with this ComServe pharmacist. I'm not going to explain how they got here, but at the moment they are doing their community service for 12 months, also in the government hospital. Considering that it's a 4-year degree, I'm very content and happy with my earnings. Lapa ComServe, that's what they said. Okay, basic salary 31,767. There's a rural allowance 3,800, NP cash 13,614. Okay, gross salary 55,000 rands, deductions 14,929, and a net pay of 40,000 rands. They are paying for tax, which is 13,000, furniture in the apartment 210, house rent 1.1. So because they are not permanent, guys, will notice that they are not paying for their medical. There's no medical aid, and also there is no pension. Okay, but yeah, I think it's a good one, guys. For ComServe, I wonder how it is once you are done with your ComServe, in terms of placements. Is it still easy maybe to get a job in this space? I'm just wondering. Right, now let's go to a pharmacy assistant. Okay, so this one has a certificate in post basic pharmacist assistant, years of experience, 5 years in pharmacy assistant, but in quality assurance I have 0 experience. Normal pay 30,000 rands, and then they pay for UIF and tax. That gives them a net pay of 25,000 rand. They work for a private lab. Okay, I think it's good. I don't know what you think, guys, but I think it's a good one. Right, now let's go to this enrolled nurse. Guys, I must tell you, I'm an enrolled nurse or staff nurse, those junior nurses that wear white epaulets on their shoulders with 10 years experience. I work for a private company in Gauteng. Let's see how much she is getting. Basic salary 29,144. Sunday 1.9, health grant 1.4, shift allowance 10,149, overtime 1.9. Total earnings for this month 44,560. And then after deductions they got 31,548. Remember, it differs from month to month because overtime, obviously, we need to consider that. They are paying for retirement 2.1, and I think this is medical aid. Yeah, guys, net pay of 31,000 rands for this enrolled nurse working in private. Okay, right, now let's see this medical technologist. Hi Boni, I'm a medical technologist in clinical pathology by profession, qualified in 2015, and I have worked in different sectors such as mining, laboratory diagnosis, and public health. All right, the payslip I'm about to share is from 2 different companies. During the pandemic, health workers were being paid more, and now salaries and benefits have drastically dropped. Okay, in the first payslip, there were benefits, okay, such as paid accommodation, flights, school fees assistant, which was about 5,000 rands, relocation assistant, own laptop and smartwatch, hey, medical aid, car company rental. Hey, guys, it was popping. It was popping, hey. And then we second pay slip as Bonella now, where there are no benefits except for provident fund. Okay, I hope this will help young people to make the right decisions. It takes 4 to 5 years to qualify as a medical technologist, scientist, or medical technologist or scientist, but imali ayibonakali. How? When I started, there were only 7 people that graduated with me, so this course is no joke, but it doesn't pay at all. Okay, yo, why are you discouraging us now? Okay, so let's see the first pay slip. So this pay slip was in 2021, so she just wanted to show me the difference between the two. Okay, and she was working for a mine. Okay, overtime weekend 1.3, basic salary 37,800, non-pensionable allowance 9,000, meal advance 9,000, mid advance 9,000. Hibo, yeah, critical skills 5.6. Okay, total earnings, sorry guys, total earnings 55,719. Okay, total deductions 13,811, and a net pay of 41,907. Right, so the recent pay slip is now that things have settled down pandemic wise. Salary 36,351, provident fund 4,000 rands. Okay, that's the only thing that they showed me, and they are no longer in that they are no longer in the mine. Okay, so when I look at this, basic salary is 36,000 in 2024. Let's see basic salary back then, it was 37,800. so I think obviously guys this one looks like it had more because big nalama allowances and stuff. But I get you when you say it doesn't pay much. The course is chowing, but it doesn't pay much. Alrighty, now let's go to this radiographer before we head over to the doctor. Okay, I'm a radiographer working in theater with 1 year experience post-com serve. So let's see how much she is earning. Basic salary 42,000 rands, travel reimbursement 1,000 rands, standby fees 1.650, overtime 6.2, gross earnings 51,320, total deductions 11,576, and a net pay of 39,743. That's a radiographer with 1 year experience post ComServe. Now let's go to this doctor. Yo, if you notice, maybe I'm busy touching myself. Yo, my allergies, it's allergy season for me. So yeah, chef, this is why my body is so itchy. So here is a payslip of a medical doctor, grade 1, working in a rural area, doing overtime. Hey, all doctors obviously they do overtime. Basic salary 55,366, rural allowance 9,966, fixed overtime 29,447, NP cash 11,917. I know people are always asking, why is the government always giving doctors overtime? I guess it's cheaper for them to give someone overtime than to hire another person. Benefits. Okay, gross salary 106, deductions 38,413, net pay of 68,284. They are paying for tax, and also they are paying for their pension and other stuff. Net salary 68,284, basic salary 55,366. Okay, that's all I had for you today. This coming Wednesday we have a clinical psychologist in our Tea with the Village segment. She will share her journey as becoming a clinical psychologist. I know it's a very challenging route in South Africa, so look out for that. Otherwise, please like, share the video, and I'll see you in the next one. Bye.